webinar From COVID-19 to Action, Community and Clinical Response to Housing Instability. And thank you for joining us for the next 90 minutes as we discuss this very important topic. Just a couple things to go over for our agenda today. We will have two speakers and then we will transition, we will have a Q&A afterwards and transition to breakout rooms for smaller discussions. Just one thing to note, the session today is being recorded. And if you have any questions throughout either of the speakers, to please put those in the chat as we will use those for the Q&A afterwards. The next topic of just some housekeeping information is that our office studies and is interested in the scholarship of community engagement. Because this is considered research, we need to advise you of the following information. If you have any questions or concerns throughout today's session, please chat Sarah O'Connor. Just a few things that some of the discussions and group activities could be used for possible future publications. No direct quotes will be used, and we will make all anonymous comments or statements that are used in any of the notes. Before we get started today, we would like to take a moment to acknowledge the recent tragic events in Kenosha. Our thoughts are with Jacob Blake and his family, the families of the people who were killed and injured during the subsequent protests, and people all across our country who are impacted by racial injustice and the effects of structural racism. Please join me in a brief pause to reflect on these tragedies and the importance of anti-racism efforts. Thank you very much for that moment. Next, I would like to introduce Dr. Saeed Ahmed, the Senior Associate Dean and Associate Provost for Community Engagement.
Thank you, Erica. Thanks, everyone, and welcome to all of you for joining us in this event. This is third in a series of webinars we have been doing, which connects with the COVID pandemic. We all know that COVID pandemic is still raging throughout our country and the world, and there is no end to the sight. But we also figured out it could be a learning laboratory when you have a major crisis like this. So the first two webinars we did, one was connected to COVID and opioid crisis. The second one was COVID and food insecurity. Today's we have one with the COVID and housing instability and homelessness. We all know the thing gets worse when there is a confluence of multiple critical factors. So we have pandemic of COVID, we have pandemic of racism that is going on for hundreds of years. And of course, we also have a pandemic of disinformation or misinformation, which makes all the other function more difficult and fruitless. But we come from a positive mindset. So we look for an action which can help us to address the housing instability and what we can do about it. We know that all the social determinants of health, health disparity, racism, these are all interconnected. And sometimes it is hard to take one from the other and address it. But we have to be also focused on particular area to make a larger comprehensive impact. So our focus again is the housing instability in our country. We have actually long known that housing instability is connected to poor health outcome. Actually, to a great extent, housing is healthcare. If you have a stable house that gives you safety, privacy, place to rest, place to recover from illness, all of those has an impact on your health. Even before COVID-19, housing instability and homelessness were linked to the poor health outcome for both children and adults, where millions of people do have this challenge of housing instability and homelessness. But what the COVID-19 pandemic did and the subsequent economic crisis, it highlighted the critical intersection between where you live and how is your health. But we don't want to stay and dwell on the status quo. We cannot be sitting on the status quo. We need to imagine a future where the number of the housing unstable families will go down, ultimately eliminated. That will make a huge impact. We'll need cross-sector collaboration. We need federal, state investment. We'll need systemic solutions coming from the community partners and communities. We need to address the risk, high-risk population with the racial challenges and all the other factors that makes their life impacted by multitude of negative factors. And then you don't have a right health outcome. We need to address that issue. We need to address the root causes of housing instability, like affordable housing, discriminatory policies, inequitable access to financial stabilities. All of those things has to be on the table. We also need to incentivize new ideas from all to make an impact. I'd like first to introduce the first plenary speaker for this event, Jomar Hooper. His talk is titled Housing Instability During COVID. Jomar Hooper is the Executive Director of Safe and Sound Incorporated, a nonprofit organization in Milwaukee dedicated to uniting residents, youth, public safety, and community resources to build safe and empowered neighborhoods. In his role, he oversees all organizational strategies and leads the work of a staff that work in communities throughout Milwaukee to build partnerships and create opportunities for resident engagement and advancement. Following Jomar, we'll hear from Dr. Sabina Deer, whose talk is titled From Novel Virus to Novel Solutions, Service Learning During COVID-19. Dr. Deer is a practicing family doctor at the Medical College of Wisconsin since 1991. She has served on the Wauwatosa Board of Health, developing strategic plans for health in that community. She has been recognized many times as an outstanding teacher and physician. In 1997, she was named the Wisconsin Family Medicine Doctor Educator of the Year. She is also the founder and director of Homeless Outreach and Medical Education, called HOME, and Health Advocacy in Pregnancy and Infancy, called HAPPY. Both of them are service learning partnerships of the medical students at MCW and local homeless shelters. I'm delighted to have both plenary. In advance, I'm thanking all the staff and faculty joining and all the participants for this program. And I'm going to now ask our plenaries to share their time and knowledge and experience addressing both issues. I'm going to turn it over to Jomar, and Jomar will turn it over to Dr. Deer. Thanks, everyone.
Good morning, everyone. I hope everyone is doing well today. I'm excited to be here and to be able to talk about this very important subject. Thank you to all the organizers for inviting me to speak today and interact with you all. Housing instability and access to affordable housing has always been an issue that's really close to my heart. Having worked in these fields and many other fields around social work and social services for many years, and I'm excited to discuss this ever important and ever relevant topic with you all today. Something that's very timely, and I hope we can all take some lessons away from it as we continue the conversation. Next slide. Again, my name is Jomar Hooper, and I'm the Executive Director of Safe and Sound, a Milwaukee nonprofit that works to create safe neighborhoods in 10 priority areas throughout Milwaukee. Our mission is to unite residents, youth, community partners, and public safety to build safe and empowered neighborhoods. So what exactly does that mean? We hope to create a city where residents define what safety is and play an active part in bringing that vision to fruition throughout Milwaukee. Next slide. So how do we achieve our mission? We have an innovative team approach to accomplish our goals. In each neighborhood, we have a team of 3 that works with residents, partners, youth, and specifically our partners in public safety. We have a youth organizer in each district that works to collaborate with local youth serving agencies, schools, and with youth who haven't traditionally been engaged. We also have a community organizer that works to build community leaders in the neighborhoods and engage adults and our grassroots partners, organizations in each neighborhood. And lastly, we have a neighborhood safety coordinator that works as a part of the community prosecution unit within the police district and liaisons with residents to address blight and nuisance properties throughout the districts they serve. This three-pronged approach and our model allows us to work across sectors to build neighborhood safety and cohesion. Next slide. Just quickly, this is a map of our priority districts in green. As you can see, we cover a large portion of the city with our work and are fortunate to engage a significant number of residents annually. On a consistent basis, we reach over 30,000 residents throughout our work each year. Next slide. And just real quick, some of our program outputs from 2019. Just want to really highlight that we were able to engage, when I mentioned 30,000 folks, 16,000 of those being youth and 14,000 of those being adults in community events. Well, one of the things we're really excited about, we were able to abate over 1,000 nuisance concerns in 2019 as well. Next slide. So I am 5 months into my position as executive director at Safe and Sound, and I started this position the week prior to the governor's stay-at-home order around COVID. So as you can imagine, it's been a very interesting 5 months, to say the least, dealing with COVID and all that we have going on around the hope for racial justice within our community. But one of the things we've really had to do is really figure out how to do our work better and well during COVID. We normally are out in the community as much as possible, so we really had to pivot and figure out how we're going to do our work the best we can during this time period. And one of the things we've done, we really prioritized the safety of our residents and staff as we move forward to figure out what that looked like. And as an organization, we were well equipped to make this transition into the virtual world. In that transition, one area that I'm super proud to say that our work has been the ability to find resources for our residents that are needed and that we're hearing that they need, and are able to work with our partners to specifically provide information and access to resources that have been needed during the pandemic. This has included information and resources around unemployment, COVID testing, food access, and even voting access during the presidential primary. Since the stay-at-home order, we have begun to slowly do more work in the community to safely meet our residents where they are. And this has included hosting some socially distanced community meetings and moving towards dropping informational flyers into the neighborhoods we serve. We've also had to shift our mindset into quality over quantity. So no matter who we can engage, or no matter the number of folks we engage, we just want to have quality conversations versus trying to reach the largest number of people during this time frame. Next slide. Now I want to shift and talk a little bit about the housing pandemic. And as you may or may not know, prior to the COVID outbreak, Milwaukee and Wisconsin as a whole were already in a housing pandemic. For years, we have had a significant lack of quality, affordable housing in our communities. For renters in the lowest income bracket, for every 100 households that needed affordable housing, only 33 affordable homes are available. Let me say that again. So for the renters in the lowest income bracket, for every 100 households that needed affordable housing, only 33 affordable homes were available. That means 2/3 of residents in this category cannot find a home that they can afford. And by afford, I mean a place that will cost them 30% or less of their income in housing costs. Additionally, to underscore how prevalent poverty is in Milwaukee, we are the highest in the Midwest in percentage of renters. And of those renters, 42% of them earn less than $25,000 per year. And to make it worse, only 9% of available rental units are affordable to somebody making $25K per year. It's an insurmountable challenge to many of our families in the community. Next slide. So in addition to the lack of affordable housing, we are also extremely rent burdened throughout the state. A rent burdened renter is defined by any household that spends more than 30% of their income on housing. Those that are severely rent burdened spend over 50% of their income on housing costs. This graph that you see underlies the problem. Our low income populations can barely keep up, and our extremely low income population is severely hamstrung by unaffordable rents. This goes directly into our problem of eviction. I want to present a scenario for you all today. If I'm someone who earns $12 per hour on my job, my take-home pay after insurance and deductions is probably $700 every 2 weeks. To rent a one-bedroom with utilities will likely cost me $800 per month in Milwaukee, putting me squarely into the severely cost burden category. I'm most likely unable to earn much, to save much money each month. So if my car breaks down on the way to my job, it's probably going to cost me a significant amount of money to get it fixed. Now I have to choose between paying my rent and fixing the thing I need to get me to work, especially in a city like Milwaukee where our transit options are limited. So choices like this are being made every day by normal people in Milwaukee around the state. And those choices, in as little as $200, can lead to the high eviction rates, which we have seen and are on the precipice of seeing even more in Milwaukee and Wisconsin. Next slide. So although we were already in a crisis around housing instability, it could have been much worse during the beginning of COVID as the pandemic swept across our state. The unemployment rate in April in Milwaukee jumped to 14.1% in Metro Milwaukee, as many businesses were forced to close due to COVID and stay-at-home orders. With such a high level of unemployment, if not for federal and state intervention, the eviction rate for Milwaukee and around the state would have skyrocketed. Fortunately, the governor put a moratorium on evictions in March, a little bit more about that later, and the federal government passed a modest stimulus bill to provide direct payments to taxpayers and added a $600 per week add-on to unemployment claims. These things in total helped many renters survive during the first 3 months of the pandemic and were vital in maintaining housing stability for many residents throughout our state. Next slide. So with that being said, as of today, we are in the midst of a coming crisis around eviction. Why? Our unemployment rate in the city and around the state remains high, and many folks are still out of work. Many folks that are unemployed are also having trouble accessing unemployment benefits. Some who filed claims in March, April, and May still haven't begun to receive their benefits. It's estimated that over 140,000 people are still on the waiting list to receive benefits through the state. Federal assistance also dried up as a $600 enhancement ended in July, and the stimulus payments that many of us received were just a one-time payment. And I mentioned I'd come back to this. Most importantly, this is all on top of the state moratorium on evictions ending in June as well. Next slide. With the moratorium lifting, state, county, and city all allocated funding for renters to pay their rent to avoid evictions. This funding was distributed to community advocates and the Social Development Commission, but due to the high number of inquiries and applications, there has been a significant amount of delays in processing applications for this funding. I recently read stories of residents that have been evicted while waiting on their applications to get approved. In addition to these delays, the amount that has been allocated is estimated to only be a small fraction of the amount needed to cover all of the applications that these two organizations are seeing around eviction resources. Next slide. So with all that being said, the end of our eviction moratorium, our still high unemployment rate, and the difficulty in accessing help in Wisconsin. I was shocked to see, to take a look at this article that was saying evictions are down around the nation. And this was only written 10 days ago. Across American cities, evictions are down. So there must not be a current eviction crisis, correct? Next slide. Well, if you dive into the article, you will see that the headline was indeed correct. Evictions are definitely down across the nation, except in one city. So if you take a look at that caption, in July 2020, filings were low relative to a 2012 to 2016 baseline in all cities, except Milwaukee, where filings shot back up in late July and June. So that story is correct. Evictions are down across the nation, except in Milwaukee. Sometimes I feel like we're cursed, but I think we're definitely cursed with poor policy decisions around our state. Next slide. As you see from this chart, evictions were higher than normal at the beginning of the year and shot right up at the end of the eviction moratorium to levels higher than average. August is still on pace to come in higher than average as well. And there is absolutely no indication that things will be any different in September. Next slide. With this increase in evictions over the past 3 months, there are serious public health implications that we may be facing. There will be a marked increase in homelessness and overcrowding and a lack of availability in our shelters. And the most telling impact may be around the impacts around COVID-19 in our community. So I'm just gonna read this little blurb for you. Dr. Nisia Safdar, an infectious disease physician and the medical director for infection prevention at the University of Wisconsin School of Public Health, said it's impossible at this point to establish a scientific correlation between evictions and COVID-19 spread and deaths. Although diagnosed coronavirus cases are up 150% in Milwaukee, for example, since the eviction moratorium ended. If you can go back up one slide, you'll see, as I mentioned, so since the moratorium ended in June, Coronavirus cases are up 150%. As you see those June and July, you see our eviction filings are up too. Don't know if there's a direct correlation, but looking at that, it does make you want to ask some questions. Next slide. Next slide. So now, after all that, what can we do? This is the big question. What can we do as a community to try and figure out how to solve some of these issues? Number one, I think we saw definitely a correlation around the eviction moratorium and a big spike in our filing. So I think we need to figure out how we as a community can have a renewed eviction moratorium as a state. This is something that can be done on the state level. It doesn't need federal intervention. And I think it's something that we definitely need to push for as a community to figure out how we get that moratorium back up to prevent the looming crisis. I think we also need to look at increases in rental assistance coupled with mortgage relief. When I say increases in rent assistance, I mentioned that there were 30,000 inquiries that those two organizations had around rental assistance. So folks can pay their rent for the last 3 months when they've been unemployed or have had trouble accessing funds. So I think we need to figure out how we get more money into that pipeline so that every application that needs funding can actually be funded. And we also need to look at mortgage relief for some of our homeowners. A lot of our landlords are just mom and shop folks. So I'm worried about an upcoming foreclosure crisis if the folks who are in the rental properties cannot pay their rent, and the landlords can also not find suitable replacements. So there could be a second wave of foreclosure crisis through this issue as well too. Thirdly, I think we definitely need to look at how do we fix our unemployment system. It is unacceptable that as a state that we could not process all of the unemployment claims that we had during the specific time period where that money was needed the most. To have 140,000 folks still on a back list that have not gotten their benefits, that have paid into the unemployment system throughout their careers is pretty unacceptable. So we need to figure out how to fix that system and have that funding necessary when folks absolutely need it. In addition to that, the $600 enhancement that the federal government had came in handy to a ton of residents and a ton of folks who were able to pay their rent in a timely manner during this time. We need to look at as a country, what does it look like to bring back unemployment enhancement? We're still in a pandemic, there's still high unemployment. We need to be as responsive as we can as a country to those needs. And lastly, and most importantly, you may have heard this before, you may have not, but I think we really need to figure out what an expanded federal voucher program looks like. Many of you have heard of housing choice vouchers where folks can get a voucher from their local housing authority or through HUD to be able to only have to pay 30% of their income in rental housing. And this is something that if you've read the book Evicted, Matthew Desmond has been fighting hard for and saying this is something we absolutely need. And it's actually in candidate Joe Biden's new housing platform as well. I'm a big proponent of federal housing vouchers, and I do think that there needs to be a voucher for every person who needs it in this country. Statistics, I think, show that there's only about 25% of the people who qualify in this country for a housing voucher have even limited access to gain a housing voucher as well. So all that being said, there are troubling signs of what's on the way around in this crisis, and it's incumbent on all of us to advocate for the solutions. Some of these that I just mentioned, and some other ones that I think we can think of that are going to help our residents as we continue to navigate this pandemic. Next slide. So there's a lot to chew on. You know, hopefully the crisis can be held off for as long as possible. And even if we get back to pre-pandemic levels, we were still in crisis. And I think we need to figure out a way as a community, as a state, and as a country, how we can fix some of these issues. Again, my information is on the screen. I am more than happy to talk with anyone about this topic or any topic or about safe and sound moving forward too. So feel free to reach out to me, and it's great to connect with you all today. So next, I'm going to introduce Dr. Deer to come up and talk about From Novel Virus to Novel Solutions, Service Learning During COVID-19.
Thank you, Jomar, and thank you for the important work you do. Hello, everyone. Again, my name is Sabina Deer, and thank you, Dr. Ahmed, for your kind introduction and for inviting me today to share some thoughts with all of you. And thank you to his awesome organization. I also want to thank my dedicated home and happy medical students, and of course, our 3 valued community partners represented by Penny Dixon at the Milwaukee Women's Shelter, Cindy and Amy at the Guest House, and Kiana at Walker's Point. I'm going to mainly talk about COVID-19 and it's both direct and indirectly how it has impacted the homeless. How we have so far adapted during this pandemic, and hopefully close with some action steps to update old solutions and come up with new ones. So if this darn virus can be novel, well, so can we. May I have the next slide, please? So I want to briefly tell you what the Home Project is. Basically, I help grow awesome young doctors. Medical students and I go to homeless shelters and learn what the people there most need. We then put together service learning modules to provide those services while the students are able to learn how to better be doctors. These service learning modules include things like screenings and informal seminars with topics ranging from how to quit smoking to the prevention of sexually transmitted diseases. This photo, by the way, is one of my favorite pictures because I firmly believe that being involved in community outreach grows the best future. This picture was taken in 2009 when the Home Project helped found the Cream City Gardens at the Guest House. If you get a chance to look at them, please do so, because wow, these gardens produce over 4,500 pounds of fresh produce a year. So take a look at them. You have the next slide, please. So 5 years ago, under the umbrella of the Home Project, we added Happy, with more service learning modules that especially support homeless pregnant women. As you know, the infant mortality rate in this country is particularly high compared to other nations. And again, homeless Black and brown women and babies are the worst off. It is heartbreaking. The goal of Happy is to improve the infant mortality rate by supporting and educating and advocating for pregnant homeless women and their babies. And I am happy to tell you that so far we've had 5 healthy babies born, including a set of twins. May I have the next slide, please? As if being homeless is not hard enough, this pandemic has been especially tragic for the homeless. When you're living on the street, you don't have the option of staying at home. Shelters are often crowded, as we just heard, maybe more so now, making social distancing difficult or impossible. Our friends on the street, the unsheltered homeless, often to congregate, to protect themselves from other acts of violence and to watch out for each other to not overdose. Frequent hand washing is impractical if you don't have reliable access to water and soap. Mental illness and substance use disorders, which afflict many of the homeless, may impair someone's judgment as to the need for wearing a mask or for social distancing. And heavy long-term alcohol and drug use can also directly and indirectly suppress a person's immune system, making them even more likely to become infected. So not only are the homeless more likely to become infected with COVID, but once they are infected, they suffer a greater risk of complications. Because they have higher rates of underlying lung and heart disease, and they suffer from food insecurities and the resultant malnutrition, and often are elderly. So the homeless are twice as likely hospitalized with COVID infections, up to 4 times as likely to need critical care, and up to 3 times as likely to die from COVID compared to the general population. May I have the next slide, please? And then there are all the indirect harms caused by COVID-19. Across this nation, in the last 5 months, we've seen a 55% increase in domestic violence. When women were not able to leave an abusive relationship during lockdown, women living in unstable housing may be forced to endure abuse even longer. This pandemic, just like war or other large-scale tragedies, cause chronic stress. And chronic stress, we know, increases substance use, from alcohol to opioids. I see this in my practice in Wauwatosa, where I see mostly non-homeless patients, and I see it in the homeless population who have less access to coping mechanisms, such as a loving, supporting family, a supportive work environment, or psychotherapy. And then there's isolation. On the one hand, they are more crowded. On the other hand, they too have to isolate. The Milwaukee Women's Shelter, for example, has required women and their children to stay in their rooms except for meals. There is much less in-person contact with friends, co-workers, even their doctor's visits are virtual, if available at all. And there are no more hugs from friends, from staff, from co-workers. This is Brianna and one of the kids, and they used to hug all the time, and now we can't. Hugs were always such a sure way to communicate genuine love and compassion, the all-important message that you are valuable, you are loved. And that just doesn't quite come across in a foot bump. So may I have the next slide, please? So to meet people's immediate needs, we first had to listen. We listened to what our community partners and the people they serve needed right now. Initially, that literally meant, please stay away. We were all scared, and frankly still are, but the Home and Happy students reached out by phone and by email just to say, we're still here. What can we do? We are not abandoning you in this crisis during this pandemic. And that's how we found out that it would be, for example, really appreciated if we could donate some touchless thermometers and some hand sanitizers, but in fact, they were good on masks because somebody else just donated those. To meet the changing needs, that's an ongoing process. We continue to communicate with our shelter partners and to adapt as the COVID-19 pandemic unfolds. For starters, the topics which were previously requested, such as women's health, safe sex, contraception, managing high blood pressure and diabetes, suddenly nobody wanted to talk about anymore. Instead, they all wanted to talk about COVID. So we are now working on a COVID Mythbuster modules, and we have sent correct COVID information by email to the shelters. Since it was no longer safe for one another to bring our service learning modules into the shelters, we are now figuring out how to do them differently. Our plans include, for example, doing them virtually. This will require investing in some iPads and becoming tech savvy, not just ourselves, but teaching the use of these virtual platforms to the shelter residents. This may just be one of the silver linings, because being familiar with these online platforms may increase a person's ability to find a job or even engage in telehealth with their doctor in the future. One of our shelters divided their dinner time into 2 groups, allowing us to physically come back in the shelters to resume, of course, socially distanced and masked and much shorter meetings with the people who were not eating dinner right then. We're also discussing with the guest house to possibly take our mini seminars outside in those beautiful gardens. And most significantly, maybe this crisis has forced us to really think about how we can meet the medical needs of the people, meet them where the people actually are. So if we can't go in, maybe we can go out. Many cities like Los Angeles or Pittsburgh or Chicago already have extensive medical street outreach programs. Milwaukee has a budding one. And we, the Home Project, we will be joining my colleagues, David Nelson and Eric Collins and their teams. They have been providing food and clothing and housing assistance on the streets for years, and we hope to add some on-the-spot medical care. They are meeting the people where they are and not where we may want them to be. May I have the next slide, please? So what are some action steps we can all take? Adapting to new developments all the time is certainly not easy, but we are on the same team. Let's start by avoiding misleading theories and provide only scientifically sound information. This certainly is a fight on multiple levels, from encouraging folks that wearing a mask is a kind and courteous thing to do, that it helps prevent the spread of COVID-19. It's not a freedom, to combating vaccine fears. And no, Bill Gates does not want us all to be injected with tracking devices. Personally, I've rarely been successful in changing somebody's mind on any of this, but I will stand straight for scientifically sound information. We can all help to stop the spread of this virus and stop the spread of false information, which makes the disease burden even worse. What I mean by skill and passion is that we are most effective when we do what we're meant to do, what we're really good at, that for which we have fire in our bellies. That may be being a medical student or a nurse or a doctor or a social worker or an addiction specialist. We may be in a position to open our wallets or to volunteer for street life or to affect policy change. I will never be a grant writer. Dr. Ahmed loves it and is excellent at it. Let's bring our unique set of skills to this important work, and we can each become a piece of the puzzle of building solutions that remain flexible and imaginative and all-inclusive. And justice. Opening our hearts is something we are all capable of. I used to be afraid to talk to the panhandlers on the street or the homeless person who always stands at the same intersection on my way home. Then I learned their name and one thing I could do to help them. By the way, this is Benny and his friends. Sometimes I get shooed away or cussed out. Tomorrow I'll say good morning again anyway. Surprising things may happen. Like the one time I said, "Good morning, sir. What can I do for you?" to a homeless man, and he started to cry. I was horrified that I had done something awful, and I asked him why he was crying. His answer forever changed me. He said, "You are the first person to ever call me sir." This unconditional respect, the Greeks call phileo, or brotherly love for each other, this is what binds us all together. This work is a tool for peace. It comes out of a sense of duty and love and justice. When reading the news this morning, I was touched by a quote from Julia Jackson, the mother of Jacob Blake, during a speech she gave just last night in Kenosha. She said, quote, "Let us use our hearts, our love, and our intelligence to work together and show the world how humans are supposed to treat each other," end of quote. We must be able to trust each other. Trust takes time, it takes commitment, it takes kindness and unconditional respect. It requires us to be real, authentic, or what my colleagues Brett and Corinne Feldman, they are the founders of the LA Street Medicine, call authentic solidarity. I try my very best to show up when I said I would, and I do what I promised. Above all, Let's stay connected. Continuity is critical. That's how we build trust. That's how we find out what is needed. The relationship with you, whatever your job, may be one of the most stable relationships a homeless person may have. I will close with a quote from my friend and mentor, Dr. Saeed Ahmed. Community engagement is built at the speed of trust. We have the last slide, please, so I can say thank you to you all, and thank you for the awesome work you do. I'd be happy to take any questions you may have.
Thank you so much to both of our plenary speakers. At this point, we will jump into some questions, and I am monitoring the chat. So if you would like to send anything through, we can add that. I'm going to start with a question for Jomar. How does health intersect with the mission of Safe and Sound?
Well, you know, I also saw Dr. Nelson had another question around that as well too. So I can kind of take both those questions at the same time because they're a little bit similar. Health interacts in so many ways. I think, you know, Milwaukee is a city of disparities, and those disparities go across community lines, they go across district lines, and they go across neighborhood lines. And we see those disparities show up in the conversations and the feedback and what we hear from our residents. So to me, I think that the conversation around healthcare is always intertwined into the conversations that we're having, whether that's someone who needs access to specific services or whatever. Their health often plays a big part into how they're able to access other services throughout the community. And I would say how we can, as healthcare providers and as folks who are doing healthcare, help out with community agencies. I think there's kind of a three-pronged approach, which I kind of see. I'm going to be real specific about the first piece is mental health. I think that's an area where we as folks who are on the ground doing this work in the community don't really have the knowledge base that we should right now to be able to either specifically recognize concerns around mental health, and B, if we can recognize them, to be able to have the ability to refer them to proper services or even know where to take them or tell them to go. So I think those are the two pieces that are really missing around mental health. Next, I think it's just, you know, there's a lack of, I guess I would say it's siloed in our community, very much so. There is so many resources out there in the community for folks who have issues, who have concerns around their health, whether it's mental or physical health. But the folks who are having some of these day-to-day conversations in the community don't know what those resources are. One of the things I mentioned as Safe and Sound, we pivoted to started finding out what resources are out in the community and then being able to distribute those to folks. We need to know as an organization what the healthcare providers have available, what are the hours they're open, what services are free, what's going on in the community so that we can directly talk when we're having these conversations, tell people directly where to go. And again, those direct referral networks are important to us. So we need to be able to break down those silos as a community between organizations and healthcare providers so that we can, the left hand is talking with the right hand as a community.
Great, thank you. So now I want to ask Dr. Deer. You mentioned the work that's happening developing a street medicine program. How can we also in the traditional healthcare system better serve those who are experiencing instability or homelessness?
That is a great question, and I am afraid that in the traditional medical system, which we need policy change, namely that I think we need a universal healthcare, so that I think healthcare is a human right, not a privilege, and right now, I am an employee of the Medical College of Wisconsin and community physicians, and I am not allowed to see somebody for free. I am not allowed to write off a bill. Billing will work with somebody, but I cannot. I used to be able to just say, you know what, that was free. So we need policy change. We need an overhaul of our health insurance system. And I grew up in Europe, in Germany and Switzerland, where we have universal health care. And, you know, it's completely doable, and we have better health outcomes than the United States. So I think while I've clearly chosen the United States to be my new home, I think we can learn a lot from other countries and how to tackle this problem.
And Dr. Deer, just to make sure that we're sort of all talking about the same thing, can you give a brief description of when you say universal health care, what you're referring to?
Well, I'm not a politician, but I think healthcare should be free. Whether that's, you know, Obamacare was a great start. It wasn't perfect, but I would very much like to see a continuation of the work on Obamacare. So I think healthcare is something that should be covered with everyone's taxes, just like, you know, I don't pay extra for being able to call 911 or the fire department.
Thank you, that's helpful. Jomar, I am going to switch back to you now and ask, what is one of the most, well, if you have a few, but what are some important things to advise or connect someone who is facing impending eviction? I'm not sure if I got that out right.
I got the gist.
Okay.
It's a great question. And as I answer it, I'm going to let you all visualize the problem in our community at this point in time as I answer this question. So if the person who's being evicted is on W-2, they can have access to emergency funds to hopefully help pay for some rent for that month. If that person is not on W-2, they can specifically go to community advocates to get an opportunity to apply for for a special pot of funds to help for emergency access. If it's a legal issue, is a discrepancy between somehow with the landlord, whether they didn't fix something and they're evicting you because there's an issue or concern, you can go to legal aid and legal action, Legal Aid Society, the Eviction Defense Project, to have a conversation around that. Or if there's just a general disagreement with the landlord and doesn't necessarily have too much to do with ability to pay, or even if it does have to do with ability to pay, there's Mediate Milwaukee. So those are the range of folks that we can call, plus there's many more around this issue. I don't know if I showed you the problem is that if I'm someone who's in crisis, how do I know to reach out, which person I'm reaching out to, or what's the time frame, or what's the number, or what's their hours? So one of the things I'm excited about as a community is that there's a current project being undertaken to create a tenant landlord resource center. It was expected to be up and running this year, but obviously COVID had put an issue that's kind of made that step back a little bit. But the goal is to have a one-stop shop in the community so that if I'm a tenant and I have an issue with eviction and I don't know where to go for emergency assistance or for legal assistance or for mediation, that I can have a one-stop shop for me to call. So my goal, the goal of the community is that's something that needs to happen relatively fast so that we don't have to continue to go through the having to figure out who to call when I'm in a crisis scenario. So all that to say is there's a ton of resources out there for folks who are facing eviction. It's just navigating it and figuring out the best way to attain those resources.
Absolutely. Thank you. I'm going to end with a final question for Dr. Deer, which is, how do we better train all future physicians about the importance of working with community?
Well, we have to we have to make it an expectation that they engage with the community from the earliest on. I mean, I really, my most wonderful students have come to the medical school with already having done community engagement in high school and in college. So this starts in our homes, raising our children to be kind and compassionate, empathic human beings. And I think it is becoming an expected part of medical school education. So I think the home project is one example of how we can implement that, make it educational and effective in the community at the same time, and really have scholarly projects come out of it as well. So it's a win-win-win situations. And I can tell you the students are having a lot of fun. It's a very popular project.
Thanks so much. On that note, I would like to again thank you so much, Jomar Hooper and Sabina Deer, both of you, for sharing your experiences and expertise with us today.
I want to start by saying I want to thank our two speakers for joining us. Jomar Hooper and Dr. Sabina Deer, you gave us a lot to think about. And I think it really was really quite interesting. Dr. Ahmed started the conversation off today by talking about how housing and health go together, but it's not as simple as just housing and health, and that people who have unstable housing have unstable health outcomes. And we heard from both our speakers about the importance of this. We ended our session, I'm going to say with what we ended our session with, and Sarah O'Connor said, being poor is like having a full-time job, a job with which you don't get paid for. And so if there's ways for us to make this easier, we need to figure out where those innovations lie, and it could be as simple as communications. Can I have somebody from the first group give us an update of the things that you spoke about, please?
Are we the first group, or is the other group the first group?
You are, Dr. Johnston. Go ahead, please.
Oh, okay. Sure. Yeah. So we had a really nice discussion. We heard from different perspectives from some of the Home Happy team members, as well as Dr. Moyer, Mr. Hooper, and some of the community engagement folks. There was a lot of talk around trying to adapt what's been going on already to meet these new unprecedented needs that are happening in the community around COVID, but also around increased burden of housing instability. There was some discussion about sharing efforts towards resources, and we're going to look forward to doing that going forward. And then there was a really interesting idea at the end that I just wanted to share. Mr. Hooper mentioned this idea of a possible area of action for low-hanging fruit around kind of a microloan type program. He's seeing a lot of people who are not meeting rent by a couple $100s perhaps, and being evicted over that, and perhaps some type of community-based, perhaps philanthropic funded way to get over that hump and really meet that need, so that life trajectory, which is so negatively impacted in so many ways, doesn't happen.
Thank you, Dr. Johnston. In fact, one of the organizations that I'm affiliated with has started a microloan program. As an example, we had a person who lost his job due to the pandemic, and then he was a couple $100s in arrears on his phone, and he was going to lose his phone. How are you going to get a job in this day and age if you don't have a phone? And there were no organizations out there to support them. So we found one that could give him that micro loan that could support that. So yes, I'm with Mr. Hooper on that. Our group was quite invested in this topic, and we really came away with really three issues that we talked about. Our learnings were that we found that as much as we want to get out of the proverbial silos, that they still exist. And that we have problems crossing over those silos and finding spaces where they're permeable. So our role is to figure out how we can have intersections with organizations and with people who are doing this type of work. And Dr. Deer's example and Jomar's example of their organizations are organizations that are regularly trying to intersect with others. I think a second point that we came up with was that, you know, we see in this community engagement, and everybody who's on this call knows this already, you could travel to India to find poverty and things to engage the community around health. But we talked about one of the local clinics, and we said that you don't have to go but 30 blocks to find something that would be considered a little India or lots of poverty not too far from home. So community engagement can literally happen in the backyard. I think the third thing that we came away with, that these issues are overlapping, and these are not simple issues, but they're complex. Many of us use an ecological model, a model where there are multiple factors that are embedded within a system. We need to, one, understand what the system consists of. Two, how do we build capacity? For example, how do we let physicians know and physician groups know about the resources that exist? And how can we get community-based organizations to tie into physicians groups to support health? And then finally, we talked about, because technology is such an amazing tool, that it's only going to get better over time. This was a powerful discussion from COVID to action, talking about housing stability. And we learned that housing does impact the health of our individual patients and of our community. And the more stable it is for one, the more stable it can be for all people. On behalf of the community engagement team at the Medical College of Wisconsin, I want to thank everybody for joining us today. We look forward to your reactions to this webinar today. Please give us your feedback. Let us know what we did well, what we can improve upon, and give us some topics that we might be able to support in the future. We thank you for investing your time today. Continued health, and God bless you all. Bye now.